This is the human side of healthcare, where we explore all aspects of today's ever-changing healthcare environment. Brought to you by the Dallas-Fort Worth Hospital Council and featuring CEO Stephen Love with co-host Thomas Miller. Now, let's make healthcare human again.
And welcome to the human side of healthcare. Thomas, did you know that we've got a COVID-19 problem?
I've heard that you could actually even put this on a hurricane scale.
Yeah, if you did, it'd be a Category 5. We're really facing some issues, and we're going to talk about this later in the bottom of the hour segment with an expert who used to be at the CDC.
Dr. Robert Haley will be with us for the whole second half of the show, but for the first half, we'd like to talk about something that is also important to North Texans, and that is sports and sports injuries.
And we're delighted that we have with us Dr. Troy Smurawa, who is the Director of Sports Medicine at the Children's Health Andrews Institute in Plano. Thank you for being with us today.
You're welcome.
Can you tell us a little bit about the Children's Health Andrews Institute in Plano, and what is your role at that health institute?
Yes, the Children's Health Andrews Institute in Plano is a facility that specializes in the evaluation and treatment and care of pediatric athletes. It has both the components of a physician as well as physical therapy and performance. So the three things are linked together. We have our physicians, that I am one of them, and I specialize in pediatric sports medicine. I'm also involved in our sports medicine outreach and education. So my role is not only seeing patients in the office, as well as going out and coordinating our athletic trainers and outreach, people that cover events, provide education for both athletes, parents, coaches, and sports organizations. The second component of our facility is sports physical therapy. Our physical therapists are trained and specialize in the rehabilitation and care of pediatric athletes in all types of sports. And their goal is not only just to restore them to their normal health, but also to help them return to their level of play at a level that they were before the injury. The third component of our facility is sports performance. And our sports performance is geared towards the young athlete and helping them become a stronger, more agile, and all-around better athlete in whatever sport they play. And the three components, the physician medical component, the physical therapy component, and the sports performance component, all work and are integrated together so that there is a seamless care of an athlete from their injury till their return to sports.
You know, during COVID-19, people had to, at the first part of the outbreak, shelter in place. So athletes of all ages were really kind of shut down for a few months. Do you think their time away from the court or from the field contributed to new injuries as sports have resumed?
I think that the time off from sports during the COVID-19 quarantine has really affected athletes in the fact that they are showing more increase in injuries. We do know that during that time, athletes weren't able to participate in any type of training, any type of conditioning, and any type of playing. So when the quarantine was over, a lot of these athletes returned to their sports, and they returned to them at the level that they were before they stopped for the quarantine. So because of that, they are competing at a high level without having the typical preseason training and conditioning. So they jump back into the sports at a high level of activity without the appropriate conditioning. And I believe this has led to an increase in both acute injuries as well as overuse injuries in young athletes.
You just mentioned something, overuse injuries. Can you explain to our listeners what is an overuse injury and what are some factors that contribute to overuse injuries?
Overuse injuries are a result of repetitive stress on either a bone, muscle, or tendon, which results in the tissue to break down and causes pain and sometimes can lead to weakening and tearing of that muscle, tendon, or the bone. Some of the factors that contribute to overuse injuries are what we call the too much, too soon, too frequent approach. What this means is that an athlete is jumping back or performing a sport relatively too much in volume, they're doing it too frequently, and they may be doing it too high intensity. And this often leads to overstress on the muscle or tendon tissue and results in overuse injury. We do know that focusing on gradual conditioning and progression into the sport can reduce the risk of overuse injuries. We also know that technique and biomechanics can also contribute to overuse injuries. If an athlete is performing a sport like a baseball pitcher or another type of sport where it involves a repetitive activity like running, if they have poor biomechanics or poor mechanics with their sports performance, that can put extra stress or abnormal stress on certain tissues, which can lead to an overuse injury as well.
Would you say that overuse injuries are different in children and, say, adolescents as compared to adults?
Yes, we do see a different pattern of overuse injuries in children and teens as compared to adults. Young children and teens are growing and developing. The adolescent and the young athlete skeletal system has growing bones. And these growing bones, called growth centers, are more susceptible to overuse injury. An example of an overuse injury to a growth center would be a baseball pitcher who develops elbow pain. We call this Little League elbow because it happens at an age where they're in Little League and the growth center in the elbow is rapidly developing, and the stress from repetitive pitching puts stress in that growth center and it causes it to be inflamed. There are a lot of other areas in the skeletal system of the young athlete that are more stressed to overuse with repetitive injuries. So we do see a different pattern, and when we see kids, we really want to address that because sometimes these injuries to the growth center can lead to more permanent injuries, and we need to really pay attention to that in a young athlete so that we can minimize the stress on these growth centers and treat them appropriately so that they can return to their sport without having it recur.
In your experience, would you say that overuse injuries are more common in females or males?
I think overuse injuries are about common in both males and females, but the reason or the types of overuse injuries may vary. In females, they tend to have injuries related to greater laxity and instability of muscles, tendons, and joints. So this can result in anterior knee pain where the kneecap is moving and shifting. It can result in repetitive shoulder instability from there being laxity in the shoulder. We also see that males tend to have overuse injuries due to greater muscular strength and muscle tightness. So they'll have more likely to have muscle tendon injuries like hamstring tendonitis. They'll have other types of injuries that involve tighter muscles that are more of the compressive forces than the laxity and looseness that we see in female athletes.
This is Dr. Troy Smurawa from the Children's Health Andrews Institute up in Plano talking about keeping our precious young ones safe as they have returned to fall sports. Because of that inactivity period earlier in the year, injuries are up, and he will tell us more when we come back on the human side of healthcare.
This is the human side of healthcare on 1080 KRLD and the radio.com app, where we feature healthcare's hottest topics and what our North Texas area hospitals are doing to make healthcare human again.
And welcome back. We're going to continue our conversation with Dr. Troy Smurawa. He's the Director of Sports Medicine at Children's Health Andrews Institute up in Plano. You know, if you've been watching football so far this fall, you know that ACL injuries are up. Dr. Smurawa, is there a particular reason for that this year?
Well, that's a good point. In looking at the trends, there does seem to be a gradual upward trend, and that's hard to tell whether there is actually one specific or a combination of reasons of cause for that. We do know that with different changes in preseason conditioning, that a lot of the NFL players are not required to participate in preseason conditioning with the team, and so they're on their own and condition together. And maybe we find that might contribute to lower conditioning levels and a higher risk of ACL tears during the sports. The other thing to consider is there are other changes in the way football is played in the NFL. There's one condition where we see that teams are playing a higher level of spread offenses that are faster paced. And so there is more reliance on skilled players, and the skilled players are out doing their activities. And most ACL injuries are non-contact injuries. That means that the knee it gets injured while they plant, cut, and pivot, and a majority of the time that is without contact with another player. So there we see the higher skill level players, the running backs, the receivers, the defensive backs that are playing those higher skill positions in a higher fast-paced offense, and there's more plays per game, that they're more exposure, more at risk of getting an injury. Also, we may see that in the NFL, we talked about preseason conditioning, but there's also the trend of protecting the older or higher level athletes. So you see in the preseason, they may not be playing as many practices or games or scrimmages than they were when they're a rookie. And we also see that obviously the rookie player in the preseason is trying to play more so that they can make a spot on the team. So they may be more at risk, just more so from the amount of exposure and time playing with the team that allows them to have a more likelihood of tearing their ACL while they're playing in that sport at that time.
You've done a great job of talking about some of the different positions, the defensive backs, playing time, etc. Is there anything else that maybe some people are just more at risk for ACL injuries than others?
Yes, that is a very good question. We do know that certain sports that involve a lot of the plant cutting and twisting, such as football, basketball, and soccer, have a higher incidence of ACL tears. But we do know that there is a trend that there are more ACL tears per players in females. So female athletes have a higher incidence of ACL tears than their male counterparts. And there may be multiple reasons for that. And over the years, sports medicine experts have studied the trends of ACL injuries in female athletes compared to male athletes. And what they find is it's probably related to motor control of their body when they're planting and cutting or changing directions, whereas a male may have more control of their hip and their knee when they're landing or twisting. A female may not have that control, so there's more of a rotational twisting injury on the knee, which stresses the ACL and tears the ACL.
Children's Health has a great article related to preventing ACL injuries on its website. But in addition to that, if you were talking to young athletes, what would you recommend to them that would help prevent ACL injuries?
Well, I think the biggest thing is that as they're involved in a sport that has a higher risk for ACL tears, such as football, basketball, and soccer, that they're aware of that. What I would recommend is that most young athletes, usually at an age in middle school and early high school, that they start preparing their body for strengthening and conditioning. So that means developing a strong foundation, so developing skills and strength that can protect their knee. Also, it involves doing off-season and preseason training that they will prepare not only to strengthen their knee and their body, but also to gradually progress into the intensity and the type of sport that they were playing, that they will be able to protect their knee and from getting injured while they're playing in that sport. And I think from the young female perspective, we really strongly encourage young females to really get engaged in a knee injury prevention program. And that usually is the best between the ages of 12 to 14 or 16. And they're in that stage where they're growing and developing. And that growth and development causes change in their body mechanics and alignment that may put them at a higher risk of tearing the ACL when they're playing in sports such as basketball and soccer. So by participating in a knee injury prevention program, they're going to work on body mechanics and balance, core and trunk stability, and strengthening exercises that will help them be able to tolerate the change in direction, the landing, and the rigors of the sports that put a stress on the knee while they're playing.
What are some of the general points that you tell athletes to help prevent ACL tears? And I'm thinking about the article that you also have on your website. We should reference that too.
Yes. So, and we talk about ACL tears. Unfortunately, there isn't anything you can do to prevent them 100%, except not playing in a sport. So we do know that we want to identify those athletes in those sports that are higher risk and make sure that they are aware of the higher risk of ACL tears in that type of athlete or that type of sport. The first thing I would recommend is that they really focus on strengthening and body and motor control so that they know how to properly change directions, land and plant and twist so that they can protect their knee. The second thing that I would focus on is that they really develop a strong foundation in the skills. What we don't want athletes to do is to try to participate in a sport and do higher levels of skills than their body is ready to do. So we always want to start from the simple skills and build up on them. So when I say simple skills, we're talking about things like skipping type of activities, bounding, running, cutting, jumping, the basic skills. And then as they can build on that foundation, then they can add on to higher level of skills for their specific sport. And that way they will reduce the amount of injury risk from getting an ACL tear. Also, it's important to know that hydration, nutrition, and fatigue all play a role in it. So if you are poorly hydrated, have poor nutrition, and are fatigued, you're more likely to re-injure or injure your knee at that time. So we want to make sure that they're developing endurance, they're taking a break from their sport and resting when they need to, and that they're also staying hydrated and have proper nutrition throughout their training, practice, and games.
You know, today, Dr. Smurawa, these kids have a great competitor to sports and outdoor activities. It's the iPad, it's the games, it's the technology in our lives that is unavoidable. What do you see at the Institute about kids that are less active, possibly because of technology, versus those that are more active? Does that make a difference?
I think from the general population of young kids that are active from early on, they are the ones that are better off at learning motor development, motor control, and skills. So they're less likely to get injuries, although they may be at a higher risk because they're participating in sports. But I think overall, if a young athlete starts at an early age, 5, 6 years of age, and is being active, they will actually develop more strength, better motor control, and better body awareness so that when they participate in sports or physical activities, they're less likely to cause an injury and more likely to recover from an injury if they do get injured.
Is there anything else you'd like to add or anything you'd like to tell our listeners that we have not covered?
Thank you, and I appreciate the opportunity to speak with you. Yes, I would say that sports and athletics are an important aspect of a young person's life, whether they're a competitive athlete or a recreational athlete or just an athlete a student that's out playing, because sports and athletics help to build confidence, build physical awareness, and also good health. And kids that are out playing are going to have a better mental attitude as well as a physical component of health. And with that, kids that are active and playing in sports oftentimes are more successful in the classroom. So I think children playing and participating in sports and physical activities is a key component to their life and their growth and development, as well as it affect on their cognitive development and their academic performance in the classroom.
Dr. Smurawa, thank you for sharing your insights on how we can keep our kids safer in sports. If you've missed some of our shows or interviews, you'd like to catch up on them, The Human Side of Healthcare is probably on your favorite podcast app, and everything is there, including bonus full-length episodes. COVID is back, folks, and Dr. Robert Haley from the University of Texas Southwestern Medical Center is going to tell us about it, including some very important tips for the holidays. That's next on The Human Side of Healthcare.
The DFW Hospital Council, along with our over 90 member hospitals in North Texas, are proud to bring you the human side of healthcare with Council President and CEO Stephen Love and co-host Thomas Miller.
And we have a lot to pack into this segment, so we're going to go straight to it. This is Dr. Robert Haley from the University of Texas Southwestern Medical Center in Dallas. Also spent 10 years at the CDC and served our country with the U.S. Armed Forces Veterans Distinguished Chair for Medical Research, honoring America's Gulf War veterans. So here now are Steve Love and Dr. Robert Haley.
You know, Dr. Haley, I was just checking the numbers, and we're in for a big surge here, it looks like, in North Texas. We're currently running about 93.8% of the COVID-19 patients in our hospitals that we were running at the very high point back in the middle of July. And it looks like the community spread continues. Is that what your numbers are showing?
Yeah, that's what we're seeing, and our very sophisticated computer modeling people are confirming that it looks like this is a big third wave that's finally hitting. We've been worried about that, and it's finally coming. The first two waves, the first one back when the thing first began in March, and then the one that happened in the middle of the summer, both of those, they took off very fast. And once it started going, it just shot up like straight up, where in about 3 weeks you went from maybe a couple of hundred cases a day up to maybe 1,600 cases a day. Well, you know, in the middle of the summer, when we saw that shoot up to a huge number, the governor very wisely passed or ordered a statewide masking mandate, and that turns out to have been really critical. And immediately, that huge number of cases began to fall. Within a week, it began to fall, and as everybody was wearing masks and distancing, and then by the end of the summer, it was gone back down to the baseline. It looked like we'd whipped this thing, and it's been staying there. But over the last 6 or 8 weeks, we've seen a different thing. We've seen a very slow rise up to a plateau, and it looked like it was going to plateau there. But in the last week, it's just suddenly taking off again like it did before.
To our listeners, they may not know. Can you explain to them what an R naught or an RT factor is before I ask my next question?
Yeah, the R naught, or the RT as it's called, is the reproduction number. And what that basically tells you is how many other people does each infected person infect. That is, if I were to get the infection, how many people would I then infect? And things like measles, which are very, very highly infectious, can have an R naught of about 15 or so, where each case would infect an average of 15 other people. That's an explosive spread. Well, the coronavirus is not nearly that contagious, but it is more contagious than other things that we see. R naught's about, if you're not doing anything to control it, it's about 2.5 to 3, and that's really dangerous. But since we got the masking mandate in the state, it's kept below 1. If the R naught goes below 1, that is less than one person infected by every case, then the infection will go away. But if it goes back above 1 a little bit, that it'll start coming back. Well, now it's about 1.2. And that's a level at which it can start exploding up, and that's what we're seeing.
Thanks for explaining that. And the reason is, and you've almost answered my question, I was on a call with some of these very sophisticated modelers this week from across North Texas, people from Fort Worth, Dallas, and so on and so forth. And they all said what you said. They had seen the R naught bounce around from 1.0 to 1.25, but currently it was in the 1.2 range. If we stay there, we're going to continue to see community spread, aren't we?
Yes, we are, and let me tell you why the public needs to really be concerned about this. And the reason for it is, if you overrun your hospitals, that is, if we run out of beds and run out of ICU beds, of course, the first thing the hospitals will do, they all have a surge plan where they can expand the number of beds, but there's a limit to that. And if you exceed that limit, what that means is the next people who get infected and need to go in the hospital and maybe be in the ICU, there won't be an ICU bed. And the hospital will have to just tell you, I'm sorry, we don't have any beds. You're going to have to go home and take your chances. Now, do you really want to, get infected with this germ, be one of the people who has a life-threatening infection, go to the hospital and they say, I'm sorry, there's no room in the inn for you? And that's really what's going to happen. That has happened in a few places. And, El Paso is being overrun right now. And up in the Midwest, up in the Dakotas, their hospitals being overrun. And we don't want that to happen. But if we don't stop this now, I'll tell you, we're going to be overrun. And remember, when you start seeing the cases, these are cases that developed the infection 2 weeks earlier. So right now, our hospitals aren't overrun. But if we don't react quickly now, 2 weeks from now, they will be. But we could stop that if we all get busy right now and start wearing a mask and social distancing, because that can whip this virus.
Dr. Haley, in your experience, and this is an unfair question because I'm asking you to speculate, I was talking to a critical care physician this week, and he said, Steve, the thing that's worrying me, we got cold weather coming, people are going to be inside, we've got the holidays coming, and traditionally, and he said maybe it won't be a tradition this year, between Thanksgiving and Christmas, we generally have a surge of influenza patients. And he's saying, I'm praying that does not happen this year. Do you have any thoughts on upcoming cold weather, flu, etc.?
Oh, yes. The good news is it's in our power to prevent that from happening. Texans could prevent that from happening. If everybody would wear a mask when you're around other people, and this year, skip the big family gathering for Thanksgiving and Christmas. Skip it this year. Just this year. We can go back to it next year. And then wear a mask when you're around other people. The COVID epidemic would go down to nothing, and we would absolutely skip flu this year. We would not have flu this year. And the reason we know that is every year, when we can always tell how bad our flu epidemic is going to be by looking at South America and Australia in the Southern Hemisphere, because they tend to get what we're going to get sooner. And this year, the Southern Hemisphere had very few flu infections because they were all wearing masks, okay? They've showed us that if you wear masks, it will not spread around the country. That would be nice for us to do every year at flu season, but I'm not expecting that time. But this year we need to do that. So if you decide to have a family gathering with people who aren't living in your household all the time, you just can't do that unless everybody will stay masked, or have an outdoor gathering where people remain distancing, but outdoors is more forgiving. But if you come indoors, if you all wear masks, you're going to be okay. But if you don't, it's going to spread around your family, and your grandmother and your mother and your brother are going to be in an intensive care unit in Parkland or one of our other hospitals. So wearing a mask prevents all of this stuff.
That's a good point. In fact, you reiterated what I heard a physician, infectious disease doctor in Fort Worth said. If you have out-of-town family, you've got to treat them not like immediate or extended family. You've got to wear a mask around them, and they've got to wear a mask around you. You've just got to do it.
That's right. Everybody needs to remember that the person that's going to infect you is not going to be sick. The person who infects you is either a younger person who's infected and infectious, could infect you, but they're never going to get symptoms, or it's an older person who is going to get sick tomorrow, okay? But for the 2 or 3 days before they break out with symptoms, they can be highly infectious. So don't think because somebody looks well that they're not going to give you a fatal dose. It's going to put you in the intensive care unit and maybe die. That's where almost all the cases come from.
I know early on we talked about Dallas County, Tarrant County, Collin County, Denton County, and that was kind of the epicenter. But I've been looking at the numbers. Ellis County and Grayson County are really growing exponentially in their cases and hospitalizations. In fact, Grayson County has run higher inpatient COVID-positive patients in the last 4 weeks than Denton County. This is spreading throughout rural communities.
You bet it is. We wondered early on, would they be spared? Because, in rural counties, people are farther apart. They don't have such population centers, and the epidemic first began and spread around in our big cities. But, back in August, remember there was this big motorcycle rally in Sturgis, South Dakota? 500,000 motorcycle riders came together in a big convention, and they ate in restaurants, and without masks. They went to bars, they socialized for 10 days, virtually without masks. And then they drove out and drove to all the cities, but particularly rural communities. And within a few weeks after that, we started seeing COVID breaking out early in South Dakota and then North Dakota, which are still being overrun. And in all those rural areas, because the motorcycle riders came back and spread it to all these rural communities all over the United States, but particularly in the Midwest, all the way down to Texas here. So it's in the rural communities, it's spreading rapidly, and in the rural communities, their hospitals are smaller, fewer intensive care beds, so they're going to be much more easily overrun as this thing grows. But we don't have to have that. If we would all mask, this goes away.
Quick break coming up. More with Dr. Robert Haley from the University of Texas Southwestern Medical Center about the COVID wave in North Texas. Next on the human side of healthcare.
We're continuing our conversation on how you can empower yourself to have the best health possible in today's ever-changing healthcare environment. This is the human side of healthcare with DFW Hospital Council President and CEO Stephen Love and co-host Thomas Miller.
Welcome back to the program that is brought to you by the hospitals of North Texas, the human side of healthcare. COVID got really personal really fast for me back in March when a good friend of mine in Colorado died from the disease while it was still in its very early stages. Well, once again, COVID came knocking. Some good friends in Houston contracted the disease while on a road trip. We're going to start with that story as we rejoin our interview with Dr. Robert Haley, who is professor of internal medicine and the director of the Division of Epidemiology in the Internal Medicine Department at UT Southwestern Medical Center in Dallas.
I want Thomas to tell you he's got 2 good friends in Houston who have been so cautious, but they let their guard down. Thomas, tell Dr. Haley what happened.
They went on a 12-day RV trip to go look at fall colors.
Mm-hmm.
And they brought something back to Houston with them that they didn't leave with.
Ooh.
Let me read you just a couple of things that she wrote of what they experienced. First of all, really bad headaches, said she never gets them. Bad diarrhea, she never gets that. Super sleepy. Left hip pain, couldn't put weight on her left hip for 24 hours. Heart palpitations, heart racing while sitting, joint pains around the body, dizziness one day, burning eyes, couldn't look at the kitchen lights in her kitchen, had to turn the lights off for 2 days, no appetite, fatigue. Her husband had skin burning, bones felt like they were breaking, skin peeling on fingers, fever on and off, and just major fatigue.
Yep, that's a pretty typical case. And then many of those will then progress over a week or so into shortness of breath. Often people describe a weight on their chest, like somebody set a huge weight right on their chest, an anvil right on their chest, and severe chest pain. And then in the most unlucky ones, that progresses where you just can't breathe, can't get enough oxygen in, and you have to go into the intensive care unit and maybe be intubated on a respirator for a while. So, yeah, this is a horrible disease. I've got a good friend with a very similar story. This is a young man who had a new employee who came to work, and he took the employee to lunch. Of course, they took their masks off for lunch, but they sat across the table for a long lunch to talk about the job. the next day that new employee became ill, and then a few days later my friend became ill, and now he's got shortness of breath and coughing and in bed, and we hope he gets better. But that's how it happens. It's so innocent. You think life is back to normal. Well, it's not. It's that person who it doesn't look sick, the person who was perhaps riding in the car with your friends, who doesn't look sick, that's the one who gives it to you.
What about these articles that I've been seeing lately about psychological issues coming up, even up to 90 or 120 days after people contact COVID?
Well, there's no doubt that this virus does attack the brain, actually in different ways. I mean, in the most unlucky people, it can cause a stroke. It can cause a blood vessel in the brain to clot, cutting off the circulation to part of the brain. You can have a stroke, and it can be fatal. But in others, the virus itself can do some damage. But one of the hallmarks of this virus is that it causes your body to produce a severe inflammatory reaction, where your normal inflammatory system just goes wild to kill the virus, but then it doesn't shut off. And that inflammatory state can affect your brain and produce inflammation of the brain, even if the virus didn't get up there. The inflammation gets up there, and then that may last for days, weeks, months, and some it may be permanent. And what that does, it gives you that brain fog and difficulty thinking and concentrating, maybe body pain that can be chronic, can be long-term. And so the inflammatory part of this that you're left with can be as bad as the virus itself.
So right now, where we are, it's on the increase. People are not either aware that it's on the increase or just not doing everything that we can do, and we've got a problem coming is basically what you're telling us.
That's correct. And, I think it's worth pointing out that a group that appears to be at maybe highest risk are essential workers out there in the economy, particularly construction workers, who can pick this up on the job and then bring it back and infect their family, because particularly construction workers who work on indoor jobs or working with fellow construction workers, and they're tearing out insides of a building or finishing the insides of a building, working together in close contact and not thinking the other person they're working with doesn't look sick, so they're fine. But that person is about to be sick and infects them, and then they go home and give it to their family. And they may be living with grandmother, and grandmother then ends up in the ICU or dies. So for people who are living with essential workers who are out there in the population, for the next 3 or 4 or 5 months, when the construction worker comes home, they really need to take care not to expose their family, because they can expose their family, produce a fatal infection even before they start feeling bad. See, that's the deceptive thing about this virus, why it's such a bad actor.
Dr. Haley, can you give us a timeline from inception to completion related to vaccines?
Yes. In order to make a vaccine that's very safe and very effective in protecting you, the pharmaceutical companies produce maybe several vaccines, and then they will screen those in animal models and then test them in monkeys, for example, to be sure they've got something that's safe and that will stimulate the immune system. And then they go into a series of trials in humans. The phase 1 trial is just a beginning safety and effectiveness trial in a small number of people, just to be sure that it's not going to produce some bad side effect and that it will produce antibodies that will protect you. And then if that's successful, they go to a phase 2 trial that's an expanded trial where you go to hundreds of people that also include groups like children and elderly people as well as regular adults, just to be sure there's not some surprises in these special groups. And you look for any side effects and look to be sure it's producing protection. And then if that works, then you go into the big phase 3 trial, which is the final trial. And there you're doing tens of thousands, maybe 30,000 or 40,000 people, and you randomize them into the ones who get the vaccine and another group who gets the placebo, and nobody knows which one is which until the end of the trial. And you do that in a situation where out in the population where people are getting the infection from time to time, and you wait until enough people have the infection, and then you can break the code and look at the groups and see an effective vaccine would have virtually no side effects, no serious side effects, and it would have protected people so that you have very few infections in the ones who received the vaccine, and most of the infections would have occurred in people who got the placebo. And if that works, then you've got a successful vaccine that can be approved by the FDA after the scientists look at all the data. And then you have a limited approval, and they use it out in the population, and then you get formal approval. And finally, after it's out in distribution, they maintain post-marketing surveillance. So they continue to monitor it to be sure they don't find some bad, rare side effects that could only be picked up later. And usually that takes years to do, to get through all that, but it's been accomplished this time in just 8 or 10 months.
Thank you, Dr. Haley, and we will tap you again for your expertise as this story continues, Steve, to unfold.
And it really is going to unfold. And Thomas, I wasn't kidding. The way the COVID-19 is spreading, it is just like a Category 5 hurricane. Wear your mask, physical distance, wash your hands, get that flu shot.
All right, we're going to put all of Dr. Haley's unedited interview on our podcast, The Human Side of Healthcare. It's on your favorite podcast app, likely. We would encourage you to share this with your friends and family as Thanksgiving approaches, and let them hear the perspective from an expert of Dr. Haley's stature, so that we can all be on board this holiday season to do our part to keep the spread down.
Absolutely. We'll see you next week on The Human Side of Healthcare.